We're live, Dr.
Hey guys, it's
This
Dr.
one,
You got bald or no? Tell me when. We're doing a couple passes anyway, so. Tell me. You shouldn't be feeling. How are you?
I don't feel anything.
Good.
I like that.
See? You ready? You got it? Yes, no? Jordan?
3, 2, 1. And Dr. Emer, you are live.
Okay. Hey guys, it's Dr. Emer, and we are doing a unique treatment today. We've posted this online before, and you guys all go really crazy. This is called Nevus of Ota treatment. It's a birthmark. These are deep blue birthmark cells acting almost like tattoo pigmentation. Sometimes you can't actually fully get these to go away. We do our best using these specialized Q-switch or pico lasers. Here we're basically going over, you use some with my patch. It's a perfluorodecolin patch. This patch allows me to go a little bit deeper actually with the laser. And so you guys can see we're targeting pigment. Look at her original picture. Take a look here. All this deep pigment here. Now look at it. It's all being broken apart by the laser. We're using this patch, which is made, it has a chemical wash with it that allows me to actually go deeper and do multiple passes at the same time. In the old days, because I've been doing this a while, you guys, you weren't able to do that. We'd have to do what was called the R20 method. And the R20 method was we would do a treatment and wait 20 minutes before the next pass. And then we'd have to do that 3 different times, and the person would be here for 3 hours. Now with this method, we're able to do this in about 5 to 10 minutes. We do have a protective eye shield. I'm sure they're freaking out. What are they saying?
Someone said, my boy.
Hey.
Someone said, love you.
Love you guys. I really want to change her life with this. I mean, she's very beautiful regardless of the birthmark, but it's something that stands out. I do want to show you guys. She looks like Iron Man. We have protective eye shields in here, okay, in her eye. And then what I'm gonna do is, so you guys can see here, we're gonna take some more of the gel. And you guys can see this is the perfluorodecolin. We're gonna paint it onto the skin. What that does is that absorbs the gases that are being released by the laser. Take a look, I painted it right here. Look at the frosting. The gases are now being absorbed so that the pigment can be more visible. And then I can go back on and re-laser again. So now I can do a second pass. I don't need to wait 20 or 30 minutes to get a result.
Dr. Emer, someone can't wait to see you on Monday.
I can't wait to see you either, but don't drink a lot over the weekend. If you're gonna have a procedure, I don't want you to bleed or bruise. Look at that, some of the pigment coming up. You guys can see it literally lifting from the skin. Look at that. It's coming up right out of the skin. And you guys can't do this without these metal shields inside her eye. It's very important when doing lasers around the eye. You're very protective of the retina. You don't want somebody to go blind. Also, if you put a shield in the eye and it scratches the cornea, it could be painful, very painful. That can happen though sometimes, even with numbing cream. So it's a risk we all take. So again, I'm gonna go right over the top here. I'm okay, Rosa. I'm gonna go right over the top here and get all the area. This Nevus of Ota, they're really annoying. They spread around the eye, in the eye. Unfortunately, we can't treat the pigment that's in the eye, but we can get all the pigment. Now look at that, you guys. The pigment is lifting. You see it darkening here? That means it's lifting, it's breaking apart. It's like taking pebbles and breaking it into smaller pebbles. The body's gonna eat those pebbles away.
I have a few questions for you.
And shrink it down. Yeah, go ahead. Talk whenever.
Dr. Emer, is it true lasers eventually deflates the face if you have plenty of sessions?
Absolutely not. This laser is specific for pigmentation. It has nothing to do with aging or wrinkles or volume.
A couple of our viewers would like to know, what is this for and what is happening? They've just joined and they're asking that.
Well, you can let them know.
We are removing a birthmark here with a tattoo laser. As you can see, it's lifted off. This is the before. Perfect. And this is where we are currently at.
And I'm using a specialized ruby laser, you guys. Here's the thing about the ruby. The ruby causes more whitening in the skin. Some doctors don't like to use it because the area will become what's called ghosted. What happens over time if they don't have a lot of experience is after about a year or two of the ghosting, it comes back. And we can use something called Latisse and a cream called Elidil to speed it up. So it's all based on experience. I've been doing this now 15 years. And by that experience, I know I'd rather her be a little ghosted and have no pigment. And then we work to bring the pigment back if needed. Otherwise, you're never gonna get this birthmark. And I'm doing a final, I call this the finishing touch. This is the last pass of the ruby. And you guys can see the little frosting. This is actually not frosting. This is what's called gas buildup in the skin. It's actually carbon dioxide gas that's building under the skin. And that is gonna diffuse over the next few hours.
Dr. Emer, is this only for facial treatments or can you use this anywhere on the body?
Well, you can use this for pigmentation anywhere, like the elbows, the genitals. The problem is there's a high risk of removing pigment. So if you just want pigment to be lightened, this wouldn't be the treatment. Although in Korea, unfortunately, they do this frequently for melasma. I would not suggest it, you guys. It's not the best treatment. This is more for tattoos, birthmarks, and resistant pigmentary disorders. All right.
Someone's asking, is that a silicone tape?
Yes, that's a silicone gel that's used. It's called a perfluorodecolin patch, a PFD. We use that all the time for tattoo removal and for pigment removal like this. So that's basically it, you guys. I'm just gonna fine tune a few spots. She's gonna look a little crazy for 3 to 5 days. She's gonna send all her information into Jordan so that we can gather some testimonials over the next couple days, show her live again, and that's it. Everything looks really good. I also like to look at the original photo to make sure that I hit every level of pigmentation. She actually has a little pigmentation that extends all the way down to the canthus here, so we're gonna hit that, you see? And she has that little bit of pigmentation that's speckled throughout here, so we're just gonna do a light pass, very minimal.
How long do these procedures usually last?
That's it, we're done.
And is it safe for people of color?
Well, she's of color, so yes, it's safe if done correctly. Very dark skin, again, would have more of the whitening. Take a look at her original. Now take a look after the tattoo removal. Look at all the areas now lit up. Now here's the thing everyone likes to see the most. I don't know why, maybe because it's a little scary looking. We're gonna remove the eye shield, the protective shield that's inside. So we can grab one side for me. We're gonna remove this little eye shield. This was protecting her from getting any blindness or any irritation. Close your eye. Good. And that allows, and you guys could see, that protects her entire eye so that nothing happens during treatment. That's it. Let her sit and relax now. She's now famous. And we'll go from there, and she'll update us over the next few weeks. She's gonna need, this is number 4. She's probably gonna need another 3 to 4 more treatments, but you guys can see already significant improvement. Have a good day. Perfect. Let her cool down. All right, babe. Good job. I'll see you before you go on your trip.